A very good day to you, respected colleagues and partners from Asia Pacific and across the world. Welcome to our APMENxChange webinar, which is going to be climate and environmental data for malaria control and elimination. Before that, I would like to introduce you what is APMEN that you probably know, and newly established interest groups and some webinar mechanics. APMEN stands for Asia Pacific Malaria Elimination Network, established in 2008 with 10 founding member countries and group of partner institutions. Now, APMEN Network has national malaria program from 22 Asia Pacific countries and 54 international malaria institutions. As you know, APMEN has 3 working groups: surveillance and response, vector control, and virus, which represent the APMEN core technical expertise. In addition to that, recognizing the need of cross-cutting approach to address emerging threats to malaria, APMEN members, who are National Malaria Program representatives and partners, prioritize 3 interest groups to be established, which are climate, environmental change and malaria, border malaria, and outdoor transmission. So each of these 3 cross-thematic groups is chaired by an expert from the relevant field. For example, the climate, environmental change, and malaria interest group is chaired by Dr. Kimberly Fornes. So I'm very proud to introduce Dr. Kimberly, chair of the APMEN Climate, Environmental Change, and Malaria Interest Group. Dr. Kimberly is an associate professor at the Sophie School of Public Health, National University of Singapore. She is a guest professor at the London School of Hygiene and Tropical Medicine and the University of Glasgow. Additionally, she co-leads the Climate, Environmental, and Health program at the Sophie School of Public Health. Dr. Kimberly research focused on understanding and mitigating the impact of environmental change on infectious disease dynamics. She has very good experience on utilizing Earth observation data, geostatistical method, and machine learning approach. Her work includes the spatial epidemiology of emerging zoonotic malaria in Malaysia and the Philippines, and the evaluation of association with deforestation and other land use changes. Additionally, her research program includes integrating environmental data into infectious disease surveillance system. So please join us in welcoming Dr. Kimberly for chairing our APMEN Climate, Environmental Change, and Malaria Interest Group. For the webinar mechanics, we have 3 expert presentations, which will be given back to back, and we will have then a joint Q&A session at the end. So we would like to invite our attendees to please submit questions in the Q&A box, not the chat box. So the moderator and speaker can monitor the Q&A box for the question. Additionally, I would like to suggest you precede your question with the name of the panel member you would like to respond to your question. So after the final Q&A session, there will be a very short poll. It's a really quick, 1 minute of your time we need, but for us, it's really helpful for future webinar. Please note that this webinar will be recorded and it will be available in our YouTube channel and the website. So I would like to hand over to Dr. Kimberly to proceed the webinar. Thank you very much.
Excellent. Thank you so much, Dr. Phone. I'll just share my slides quickly. So thank you so much for everyone who's taken the time to join today. We really appreciate it. And it's great to have such a diverse group of people joining this webinar series. So I think as all of us know, and the reason that we're really here today is the World Health Organization has declared that climate change is the single biggest health threat facing humanity. This is a huge change. We're all facing this in our everyday life. And this climate change and other environmental changes really threaten to undo years of progress of what we've achieved in global health. We also know the impacts are felt disproportionately across different populations, and this may further widen existing health inequalities that we face today. For those of us who work on malaria, we're also very aware that malaria has always been considered a climate-sensitive infectious disease, and climate change really has the potential to undermine existing control and elimination efforts. So we really recognize the importance of this issue, and really that we need to start thinking about how we act now. What are some of the ways we can address this? And what can we do moving forward? So of course, I think all of us are quite familiar with climate change, but we do know that our world is facing unprecedented levels of climate change. We've had several of the warmest years on record within the past few years, and we're continuing to experience these trends. So this is an environment that we haven't faced recently in recorded history, and we really need to think about how to respond to this. And of course, kind of like I had previously mentioned, these effects are felt differently in different places. When we look across the Asia Pacific, there are areas that are experiencing extreme warming and much more rapidly than other areas. We've seen areas reporting very extended dry seasons, long droughts, as well as extreme rainfall, floods, and other extreme weather events. We know, of course, that all of these climatic factors have impacts on the way that our environmental and food systems exist. So we expect that across the Asia Pacific, there'll be major impacts on agriculture, biodiversity, as well as many different aspects of human health. We also, I think it's really kind of, while we think about long-term climate change, we do think it's also really key to highlight some of the environmental changes that are impacting us now as well. So looking at some of the landscape changes. So what some of the changes that we've experienced globally and specifically across the Asia Pacific region. This is a map of tree cover loss from 1982 to 2016. So we know the Asia Pacific region has been one of the hotspots of tropical deforestation. In this region as well, many of the malaria vectors are strongly associated with forest habitats, and this is really changing the dynamics of malaria within our region. Oops. So as part of this, what we were really hoping to do is to answer and start to look at some of the key questions around climate, environmental change, and malaria. So within this kind of interest group, we're looking at how we can explore what the impacts are of climate and other environmental changes in the Asia Pacific region, as well as globally, and how we can learn from how malaria programs are operating in different parts of the world. We also need to think very urgently about how malaria programs can actually adapt to a changing environment. So what are some of the practical measures that we can take now? And as well, I think it's also really critical to think about what are opportunities for malaria programs to actually mitigate climate and environmental changes. So are there things that we could do to reduce the carbon emissions from our own work, or think about how we could do things in a more sustainable way? Or are there ways that we can actually advocate for wider climate and environmental mitigation methods, measures which may have an impact on malaria epidemiology and control? So as part of this special interest group, like Dr. Phone mentioned at the beginning, we've really just recently formed this, and we're really keen to build up a community of people who are interested in this area. So we've kind of outlined some key activities that we would like to do. One of them is really to look at how we can review research on the impacts of climate and environmental changes on malaria in the Asia Pacific region, and also kind of lessons that we can learn and share globally. From this, we want to think about how we can better support the development of policy recommendations for governments to address the challenges of climate and environmental changes and malaria. And of course, a key component of this is actually thinking about how we facilitate knowledge exchange among researchers, public health practitioners, climate and environmental scientists. And we hope that these webinars will really be a key component of doing this. As Dr. Phone already introduced, this is a cross-cutting thematic group across all APMEN working groups. We are planning to do a regular webinar series on this topic. So we'll be continuing to explore different aspects of how climate, environmental change impacts malaria. As well, we'll be following this up with the needs assessments for malaria programs in the region. So you will probably hear from us at some point in the future. But really, we wanted to emphasize that this is a group that we're hoping will be of use to many different people. So if you have any suggestions for topics you'd like to see, or if you have any of your own work or your own experiences you'd like to share, please do contact us. I've put my email here, and you can also get in touch with APMEN directly. So with that, I will introduce our first speaker. We have 3 excellent speakers today who will be really looking at some of the ways that data can be used to understand climate and environmental effects on malaria. Our first speaker will be looking at some of the impacts of climate change on malaria, and this will be followed up by work on thinking about what are some of the tools that we could actually use to understand these impacts. And finally, looking at a very specific example of how do we respond to a planned large-scale environmental change. And this is looking at the development of the new capital city in Indonesia. And so without further ado, I'll introduce our first speaker. Isabel Byrne is a research fellow and a PhD candidate at the London School of Hygiene and Tropical Medicine. Her interests are in spatial epidemiology of vector-borne diseases, and she primarily works with malaria. She's currently working and undertaking a PhD under the EU Horizons UKRI-funded project on Plasmodium vivax in Ethiopia and Madagascar, and looking at the impacts of spatial heterogeneity of disease on randomized control trials. And so, Isabel, I will hand it over to you, and thank you very much.
Thank you, Kim. I'll just share my slides. Okay, can you see them okay?
Yes, perfect.
Great. Yeah, thank you for the introduction, Kim, and to Dr. Phone as well. So my name is Isabel Byrne. I'm a research fellow and a PhD candidate at London School of Hygiene and Tropical Medicine. And today, on behalf of the World Health Organization task team on climate change, neglected tropical diseases, and malaria, I'm going to present a scoping review, which we did on this topic. So climate change, as has been introduced briefly, it already is and it will continue to impact human health in long-lasting ways. This includes and is particularly important for malaria and also for neglected tropical diseases, or NTDs, as I'll call them. Many of these diseases have very complex life cycles, often involving vectors, reservoirs, and intermediate hosts and humans as well, meaning that these diseases have, they kind of face multiple touch points of exposure to ecological, biological, and social systems. So this makes them very environmentally sensitive, so sensitive to changes in their local environment. I find this figure quite a helpful one in depicting some of these ecological touch points for malaria. So it includes all the stages of the vector's life cycle, many of these in aquatic habitats, and then looking at landscape composition, so the different habitats which may be available to the mosquito, and then to the distribution of wildlife and hosts within that landscape. So this environmental sensitivity, this increases the likelihood that we will see climate change impacting the prevalence or the incidence of these diseases, which makes it really important for us to be able to understand and hopefully to be able to predict what sort of changes we may see in future scenarios. But it also makes it very difficult. There's so many moving parts, even in that one figure, and so many unknowns that it makes it very difficult to make quite meaningful predictions with. And what we do already know is that malaria and also neglected tropical diseases, they disproportionately affect some of the most underserved and disadvantaged populations on the planet. And they're also often co-endemic, so they often impact the same communities and are impacted by similar factors as well. And similarly then, climate change is also very likely to disproportionately impact some of these most poorest and disadvantaged communities, and not to mention those who actually contributed to climate change the least. So if we want to be able to minimize these likely health implications in terms of malaria and NTDs, it's really important for us to be able to develop an understanding of what we already know in terms of climate change on these diseases. So the World Health Organization last year put together a task team on climate change, malaria, and NTDs. And this had the aim of exploring the literature to understand the predicted effects, firstly, the predicted effects of climate change on malaria and the 20 World Health Organization NTDs, and also then the potential amelioration, so improvement of these effects really through climate change mitigation and adaptation strategies. So what did we do? We used the PRISMA guidance extension for scoping reviews. So we conducted our searches in 5 databases of peer-reviewed and grey literature, and we searched for published literature from January 2010 to October 2023. We had no language restriction, and to kind of speed up the process, we used some automation and artificial intelligence-based tools as well, which were really helpful. Our inclusion and exclusion criteria. So we screened for publications which were explicitly reporting on, firstly, either the modeled or observed effects of historical, current, or forecast future climate change outcomes, and or the observed or modeled effects of climate change mitigation and adaptation strategies on these outcomes. And so in this review, we kind of defined climate change mitigation as actions which were taken to reduce the magnitude of climate change. And then climate change adaptation was actions intended to reduce the vulnerability of humans and of natural systems to the effect of climate change. So to kind of cope with past or future climate change. And as you can imagine, there was a really, really broad kind of scope of papers and a lot of heterogeneity in the studies in terms of their outcomes, the pathogens they studied, the exposures they were investigating, the kind of methodologies and their quality as well. We didn't really have the capacity to actually perform any meta-analysis. And so we didn't look deeply into their methodologies or any potential bias limitations. But instead, we did descriptively synthesize them and characterize them thematically. So first of all, in the kind of top panel here, we first grouped the papers just into those 2 different aims which we had. So those which explored the effects of climate change on malaria and NTDs, and then those which examined the potential amelioration of these effects through adaptation and mitigation. And we wanted to go a little bit further then to understand the kind of patterns which we were seeing in terms of the numbers of papers in different countries and some of the characteristics which may be coming out of those countries in terms of health and climate change. So to kind of pull out what was really being prioritized in the literature for kind of future projections and retrospective studies as well. So we went on then and we grouped the papers further by disease, so into malaria, dengue and chikungunya, other vector-borne NTDs and non-vector-borne NTDs. And then we analyzed them by the countries the study focused on, the burden the burden of the disease in that country by DALYs, the healthcare access and quality index. So this is an index where the higher the index, the better access to healthcare the population has. And then the climate change vulnerability score from the Notre Dame Adaptation Initiative. So this is a scoring that people may not be as familiar with. I certainly, as more of a malaria background than a climate background, I wasn't familiar with this study. So this is an index which it measures a country's vulnerability to climate change, and it considers 6 life-supporting services or sectors. So it includes food, water, health, ecosystem service, human habitat, and infrastructure. So countries are ranked, and if they're higher in the index, the countries are less vulnerable to climate change. And so all of these factors were analyzed using a polynomial regression then. And so just to run through the numbers quickly, we identified almost 43,000 papers. Thankfully, a lot of these were duplicates, and thankfully we had a very big team. So this was reduced down to about 9,000 articles, which were included in the title and abstract screening. Again, this was condensed down to just over 1,500 articles, which were screened, the full text were screened. And then in the end, we included 511 papers in the review. And now on to the interesting stuff, in my opinion. So these are the kind of numbers which came out of the literature review. So unsurprisingly, we saw a really big bias towards malaria in the literature. You can see that on this top panel. After that, we saw dengue and chikungunya, and then the leishmaniasis were prioritized the most in the literature. And I think it's really quite a stark figure. It highlights that a lot of these diseases truly are neglected in terms of the literature. And to me, it's a little bit worrying, just seeing that we really haven't really got a grip on what may be in store for a lot of these diseases in the climate crisis. Interestingly as well, I thought there was very little variation in the number of studies per year. Just intuitively, I would have thought that you'd see a big increase in the more recent years, just as the climate crisis is becoming more and more of a reality to us. But that didn't come out in this kind of research. And then in terms of types of study, as you can see quite clearly, the modelling and statistical study designs were by far the most common. And after that, then it was field studies and lab research. So this wasn't a huge surprise to us. Modelling is really one of the best tools which we have, and one of the only kind of ways which we can begin to investigate what may potentially be coming with the different climate scenarios. But at the same time, it's really why we are left with quite a lot of uncertainty in this field of research. And then in terms of mitigation and adaptation papers, these were quite low in the literature that we found. So 34% of papers included mitigation strategies. So 13.9% of all malaria papers, or of all papers were malaria papers considering mitigation. And then for adaptation, only 5% of papers, 2% of the overall count being malaria papers considered adaptation. So those numbers were quite low. And geographically, then, there was a really wide variation in the geographical coverage of the papers. So this also isn't surprising, because considering we were looking at retrospectively at studies which have happened, looking at what has happened in terms of climate change and what also may happen. And some of these are looking at climate scenarios, up to 100 years from now. So the colors of the maps, just to be clear, these are not any sort of prediction of burden or anything. This is simply the number of papers which we saw per country. And again, we're seeing this bias for malaria, and then a lot of papers again on chikungunya and dengue, and then a lot on schisto as well, kind of across the globe. So for those diseases like malaria, which we actually did have a good amount of papers to be able to analyze, we did see some distinct distribution patterns for malaria. So we were seeing most of the papers in African countries, but also a lot in Brazil, in China, and in India. And this really wide variation in the geographical coverage of the papers across these different diseases, that's what prompted us to do this kind of further investigation then into the links between study location, the number of papers, disease burden, and country vulnerability to climate change. To be clear here again, the higher the healthcare access and quality index, the better your access to healthcare. But then the higher your climate vulnerability score, the less vulnerable your country is to climate, just to make these graphs clear. So we found quite different disease patterns across these different groups. But for the sake of time and for giving people what they came for today, I'll stick to malaria here. So for malaria, we found quite clear trends towards more papers covering countries which actually had a high malaria burden, lower healthcare access and quality, and higher vulnerability to climate change. So it is quite a positive. It looks like the majority of these studies are kind of in countries that they are currently relevant to. So from here on, again, I'll focus on malaria a bit more, just because there was quite a lot of results which could be pulled out of this review, and we have published it now. So if you're interested in the neglected tropical diseases, you're welcome to go and have a look there. But the sort of headline findings which we found for malaria were that we definitely can expect to see a shift in the transmission suitable zones, both poleward and altitudinally. Areas of possible transmission are likely to extend to areas which were previously too cold for parasite or vector development. And we have already seen this altitudinally. Just one example is around 30% increase in malaria transmission in the African highlands between 2012 to 2017. And then kind of on the other hand, I wouldn't necessarily call it balancing it out, but on the kind of flip side of this, in areas where malaria is currently endemic, we may see conditions become too severe. For example, with extreme and prolonged droughts, we may see drops in transmission. We're likely to see malaria seasons last longer, with more climatically suitable months per year. And the one thing which we can be very certain about is we are likely to see more extreme weather events, which certainly do impact malaria transmission. And we have already seen this quite clearly already. So the severe flooding in Pakistan in 2022 and cyclones in Mozambique and Madagascar in 2023, these were followed by huge local spikes in malaria cases. So these can be driven by increased breeding of vectors in floodwaters, but also with extreme weather events, you can have total or partial breakdown of health systems, which also impacts the normal distribution of malaria control interventions. So while some of these changes may place a greater proportion of the global population at risk, the potential kind of net impact of climate change on the global population is really unclear. The heterogeneity in the papers, it really did make it almost impossible to draw any clear conclusions in terms of the kind of magnitude or the direction of the expansion of malaria, which does leave us in a very difficult position for kind of robust planning. We do know that there will be short-term impacts of extreme weather events on local incidents. So this is something that could be safeguarded against. But really, whether climate change will make malaria go up, down, stay the same, and how it will kind of interact with current and novel interventions, we really still don't know. And this is largely the same for NTDs as well. And so we addressed this kind of gaping uncertainty in the discussion, and how our hope that individual and collective behaviors will actually mitigate climate change in some meaningful way, and then how the addition of this kind of uncertainty in almost all parameters within malaria and NTD transmission models, you kind of end up questioning whether all of the effort on these projections and predictions are actually worth it. But the answer is yes. They're hugely important, firstly, for advocacy, and they are working. At COP28 this year, we saw the first ever Climate and Health Day with, I think, $1 billion pledged for climate and health by donors. And again, we saw climate included in a very meaningful way in the World Malaria Report this year. So although it may be a little bit late, it is being included in discussions now. And we should really continue to push this research forward. But it is important really just to caveat these findings with the uncertainty around them. And so with all that uncertainty, what can we actually take home? We will see changes in malaria, as well as dengue and chikungunya and leishmaniasis and several other vector-borne diseases. So we will see changes in where they're occurring, and we will see local changes in prevalence. And what can we do now? We can work to safeguard these global health gains that we have already won by scaling up interventions which we know work, and also achieving impact before they may be rendered ineffective by future changes. And so then we are still left with this really profound kind of lack of certainty in our findings. And so we gave a series of recommendations to address this, and I won't go into all of them, but they are in the paper. And these are kind of to inform a more guided scenario analysis of current and future burden. So the kind of key take homes for me from this were prioritizing standardization and collaboration in these studies, because what we can see is there really is insufficient modeling capacity globally to be able to pull out really certain conclusions. And we kind of gave some key steps towards creating a more accurate and then impactful estimates of future vulnerability and exposure and impact. And as with every piece of work, this did come with a lot of limitations as well. Again, I've listed them here, but I'll focus on kind of the top two only here. So the lack of papers on mitigation and adaptation, this was quite stark. And the kind of general consensus within the team was that there may be more out there which were potentially overlooked by the search strategy. And then the fact that in I think most, if not all, papers, future changes in kind of treatment and control strategies, as well as population changes due to displacement, supply chain disruption, and changes to vector and pathogen genetics, these were rarely included or accounted for, so limiting how these results can be interpreted. I'll just finish up here. We already know we are having an adverse influence on our planet. This is already impacting the incidence or the prevalence of many morbid diseases. Those communities and people who contributed the very least are likely those who will suffer the effects of the climate crisis the most, including increases or changes in the burden of malaria and NTDs. It's very positive that we are seeing financial commitments, and these are providing an opportunity to correct this inequity. So hopefully they continue. And yeah, really, the kind of headline from this is that we really still don't know enough. So a huge thanks to all our funders. I'm aware I've run over a little bit here, and I just wanted to make it clear that this is not my work alone. I was part of a very big team. So huge thanks to all the co-authors, especially Petra, Jennifer, and Sol for all the work. It was really nice to be involved with, and I'm looking forward to discussing it a bit further. Thank you.
Right, fantastic. Thank you, Isabel. So yes, please do put any questions for Isabel in the Q&A box, and we will have a session for all speakers where we'll be answering questions just after the talks. So our next talk is from Dr. Swapnil Mishra, who is an assistant professor at the National University of Singapore, with a primary appointment at the Salisbury Hawke School of Public Health and joint appointments at the Institute of Data Science and the Department of Statistics and Data Science. His research focuses on applying and developing statistical machine learning techniques for the broader and messier world of science and public policy, especially for global health. He develops flexible and scalable models for understanding various spatiotemporal data, for example, epidemics such as COVID-19, malaria, and HIV, as well as crime. In 2022, he co-founded the Machine Learning and Global Health Network, a collaborative initiative spanning 3 continents that brings together researchers to address global health challenges. So Swapnil, over to you to tell us a bit more about some of the tools we have available.
Yeah, thanks, Kim. Thanks, Kim, first of all, for having me here. I'm really excited. So, and thanks everyone for joining the talk. So as Kim said, I will be basically talking about what are the new tools and how the new environmental data is coming, which also means that a lot of work that I will be presenting is not necessarily my work. The work comes from a lot of great work that has been done by the community in itself. And I will be focusing on essentially what has changed in last few years and how that has transformed or how it's transforming what we could do, right? So let's start with, so actually this is one of the Kim's work where Kim talked about how the incidence of malaria is sort of related with deforestation or deforestation in Sabah. And this is a work in 2016. So I basically want to say that using satellite data or using images or using other kinds of data is not something new. It has been there. Then recently people published a new piece of work where they have used more satellite data. In this case, specifically in this work, what people have done is they have used satellite images to basically produce forecasts for dengue. And in here, they have taken various different kinds of images and stuff. And then during the time of COVID, you had a lot of work. For example, in this work, what people did was they basically used satellite images to look at burial sites, and that allowed people to basically get an estimate of how many deaths are happening. And this was actually quite critical in places where you really don't have too much groundwork or you basically are in limited resources, so which does not allow people to actually do a lot, and they can't really have a real-time surveillance. So basically having access to satellite images help people. And then if we go down to a work that was done in 2015 and which was where people talked about how do you map risk of malaria against different covariates. So where people talked about temperature, rainfall, land use cover, vegetation index, humidity, elevation, and more or less all these are basically climate or environmental features. And if you will look at them, if you go in detail, you see, even when you're talking about temperatures, these temperatures could be very different. Like people talk about different types of temperature, like they talk about temperature, they talk about what is the temperature suitability index, or at times people talk about land surface temperatures, then what kind of land use cover, rainfall, vegetation indices. So all of them have different definitions and people have been using it, and they have been shown to be important factors related to a lot of infectious diseases. And in this case, this was very specific to malaria, right? Now, the first thing that everybody would probably ask me is, so what's the point of this? Like, so why are you talking about it so much, and what does it mean? And if it's being used, why are we talking about it? Actually, the reason is this: to do any of this thing, it requires a lot of efforts on your side. And this efforts essentially come from the fact that even if satellite images exist, what you would need to do in general in here is somehow first go and acquire data. And when I say acquire data and when I say acquire training data, what you actually would need to do is you have to go and acquire data and you have to start labeling. Like, for example, in here, if you see the box that's on my in this picture, which is a left column, you will start labeling that the thing that you see in green is forest, the thing that you see in dark gray there is water, and then there is a bit of line which probably might be beach. And similarly in other figures, you have to go and start annotating all these images to say this image has this, and then you will have to build a model. You could, like how a lot of people will end up doing a machine learning, or what people now do a lot is deep learning model, and then you will test the model, and then you will have to keep doing this till you get your desired accuracy, right? But more important bit here is, or the problem here is, first of all, one that I talked about, which is about that you have to get the data and label it. But more importantly, you cannot do all of these tasks at once. So you might create a task where you're talking about what's the vegetation cover, then you will for that you will build one model. But if you then need another model that talks about roads or something, you will have to build another model. So that's where the problem happens, that you have to acquire data and also have to train or make very different kinds of models. And still, which of them is important and what's not important basically goes into the task of the person who is modeling to decide what they need to take and what's important, how much of resolution to take. Now, that's where of late a paradigm shift has happened. And this has happened essentially based on one technique, on three techniques. And the first of them is known as the self-supervised learning. Now, if you keep the details out, in a very simplistic way, what self-supervised learning says that we don't need to go and label data. What we can do is we can take an image, we can pass it through whatever our model is. So like in here, if you see, you start with a image of dog and you then take two different versions of dog's image. The only thing you want to say is these two different versions of dog images are more nearer to each other than that dog image to the image of the chair that you have on the right. Now, and equally, all the images of the chair are more nearer to each other than being nearer to the image of a dog. So that's what the repel means like. So you can go through basically a big network, or you can go through a machine learning algorithm. You can produce an output where your output is not something, your output is just some representation of that thing. And you're saying, I just want to make sure any representation of dog is more nearer to the representation of dog than to the representation of chair. And then you keep doing it again and again. So what it basically is saying is when you look at an image, even if you change that image, which is like you can tilt that image, you can flip that image, you can take away some colors, you can make it more hazy, those will be still more nearer to each other than any other image. Now, the advantage of this is we are not defining a task here. So I'm not saying you are doing forest classification or you're doing road classification. I'm neither labeling it. I'm just saying the same image, if turned differently, is more nearer to the other image. So it allows you to basically emulate these two problems. Now, once you have that, now it basically solves a lot of problem in a way that it reduces the effort, or it actually reduces the human effort that's required. It increases the amount of compute that you need, but it actually has reduced a lot of human effort that's required. And one of the ways that you could then go and use is what we have been doing, where you can take this data and you can take satellite images data, which we are taking, and then you can try to predict the incidence of malaria. Earlier, when people did it, what people did it was they basically used DHS data, which is the housing data in Africa, and then when they were conducting surveys, they would conduct surveys, and in surveys they would say, it is for this location has that much of urban population, that much of rural population, it has a river source nearby, and slow. And even if people, when they had satellite images, they did that. But that becomes quite expensive to do. So what we did was we basically just took satellite images, we trained it with the self-supervised learning algorithm, and we said, okay, now can you use those features rather than taking DHS features? Can you use this as features and other features and produce a map of prevalence? And as you could see in the map on the right here, it actually produces a decent enough number if you look at the ground truth on the left. So it allows you to do that without much doing and with quite less amount of data, which means, yeah, you still need a survey to get some understanding of prevalence, but you do need to account for other things and stuff. And also this also tells you now, because you have features for all the places where surveys have not happened, which means it gives you actually a way to produce new estimates for the places for which you never had surveys. So it allows you to extrapolate or interpolate. Now, the other new kid on the block are, like, as I said, there are three things. So the second thing that has come now is what people call as foundation models, which even if you don't know them by the name of foundation model, right now, this is what you will call as your ChatGPT, Gemini, or basically Claude, or in any of these models that people talk about. All of them are foundation models. Okay, they are foundation models for text, or they are foundation model for chatbots, but there are foundation models for different things. Now, what are foundation models? Let's just recap this. So one is, they are like a general purpose AI engines, right? So they are more or like a Swiss Army knife, that you have one model that can do a lot of things, which means you can take an output from one model and then you can go and fine tune it for others. For this example, you can basically take the model, you can use the same model to predict the land cover. You can use the same model to predict the vegetation index. You can produce the same model to find any other thing in the image. In case of satellite image we're talking about, other is they all have capacity to basically learn from a lot of knowledge, which means they are trained on a quite large amount of data. And by large amount of data, I actually mean here the internet scale data, which means they have been able to actually look at different patterns of the data that exist, not necessarily some localized or domain thing that we wanted, where we were by our hands or by using our domain, we are trying to say these two things are nearby. And then, as I said, they have got a lot of versatility, which means they allow you to do different tasks with minimal amount of intervention being needed. And then the fact that foundation models by itself are quite expensive to do, but once you have trained a foundation model, it's quite efficient to use, because once you have a model that's trained for you, the only top task that you have to do is to, let's say, do a classification regression, which can be done in a very classic way, which is not that resource intensive, which means that it allows sort of everybody to use them and use it for their benefit. So the idea of basically taking a large pre-trained foundation model and using it for specific your task does not require heavy compute, which means places which does not have high computes or marginalized computers, they could still do it, because this could then run on even smaller laptops that a lot of people have, or even smaller desktops, and on your phones also. And then finally, now because they have distilled a lot of information, they actually give you state-of-the-art performances, and that's the foundation models that's making use. So let's look at a few examples. So one of the example is this, essentially the Aurora model that's been developed by Microsoft, where they basically developed a climate and a environmental foundation model, which was trained on a lot of data around the world. But essentially now what this model allows you to do is it allows and to give you forecast for different climate factors, for different environmental factors, and it produces them for you at very large and high scales, and it actually produces it at very low resolution, which means now you can just take this model, give it specific information to the area you are worried about, and it will give you forecast for that without you really trying to train or do anything, which means it can really adapt on local situations, and that's how people are using it. Another example is the mosaic work that was done by people earlier, where basically what they have done is they have taken a lot of satellite tree images. They have trained a model which now allows you to basically query their API and say, hey, this is my image. For your image, they give you back some set of features, and now you can take the same set of features and you can use the same set of features to either predict the forest cover or to predict the population density. And the authors here showed that they actually used the same set of features, and they were able to basically do prediction for forest cover, elevation, population density, and nightlife. And they actually did, as you would see here, the predictions or the stuff that they did were as good as the state-of-the-art models. And this was one single model that was producing the same estimates for everyone. So that's the important bit, right? So this is changing how and what people could do. And then for example, this is one of the work that we are doing, where what we are doing is we are taking the satellite image data, and we are using those satellite image data to predict the child deprivation index. And in here you see the example for Kenya. And again, we are trying to show that actually you can use these models. These models do quite better than the classical spatial stats model. And again, they allow you, more importantly, they allow you to do stuff where you don't really need surveys, or you need to conduct those surveys which are quite expensive to do. So this is just an example. And the one last example that I wanted to talk about was this new kind of models, where people are actually using deep learning models, which are basically based on physics. Now, a lot of climate and environmental modeling is done based on physics models, and which have been state of the art for last many years. But a lot of those models have been quite slow, and they don't really scale that much. So of late, this work by Koshav et al. in Nature this year, they actually produced a new sort of climate model for the world, where they basically took the domain of physics and they added deep learning part on solving ordinary differential equations, and they got their stuff out. Now, the point would be, so what's the advantage if they did it? I think the biggest advantage that you can see could be seen from the next slide, which is what you see as the first thing here is their model, and what you see on the next two things are the models which are supposed to be the current state-of-the-art models. For the same amount of like time for 15 minutes, which you see here now, the newer model has been able to produce estimates for the whole world for next 15 days, almost 15 days. And in that time, the current state-of-the-art models has produced estimate only for 1 day. And in case of the other model, it has not even produced the estimate for the whole days, right? So essentially, if you see in 30 minutes, the newer model basically produced estimates for next 22 days or like 3 weeks, where the other models are hardly produces for 1.5 days. So this has reduced the computation time. It has really allowed you to do real-time stuff, and you don't need to wait if you need to really get stuff out. So this is how the new tools are essentially changing the world, and how they are changing paradigm and allowing people to use a lot of data, which does not necessarily require a lot of compute now, because once these models have been trained and these data sets are available for everybody to use, and these models are quite easy to run. Thank you.
No, fantastic, Swapnil. That was great. And it's really exciting to see all the types of data out. So again, just a reminder to everyone, please put any questions for Swapnil in the Q&A session, and we will answer them after the next presentation. So our next and final speaker is Dr. Henry Surendra, an associate professor and coordinator for the Master of Public Health program at Monash University, Indonesia, and an epidemiologist at Oxford University Clinical Research Unit in Indonesia. He obtained his PhD in malaria epidemiology from the London School of Hygiene and Tropical Medicine, and his current research includes the evaluation of zoonotic malaria transmission and agricultural land use in Indonesia, emerging risks of malaria and dengue in the new capital city of Indonesia, the COVID-19 vaccine effectiveness, and the impact of COVID-19 epidemics on TB, HIV, and childhood vaccination programs. So Henry will tell us a bit about how the malaria control program is responding to risks of the development of the new capital city of Indonesia. So Henry, over to you.
Thank you, Kim. I'm sorry, it seems that I cannot turn on my videos. Okay, now I can. Okay. Okay, thank you very much. And thank you for having me today, Kim, and welcome to all the participants. Good morning and good afternoon. So today I'm going to talk about how do we mitigate emerging malaria risk in the new capital city of Indonesia. Of course, I'm not talking on behalf of myself, but I'm talking on behalf of many collaborators from all through Indonesia, from the National University of Singapore, local and national Institute of Health in Indonesia that are involved in the work that I'm about to present today. So, yeah, you've seen this exact same slides from the first speaker, but what I'm trying to say here is that data has suggested that in recent years, like the global health security has been threatened by the geographical expansion of vector-borne infectious diseases such as malaria, dengue, and Zika and chikungunya. And for a range of these vector-borne diseases, an increase in residual transmission together with ecological heterogeneity from weather to local human migration, housing to mosquito species, behaviors presents many challenges to effective mosquito control programs. So it is a complex challenge for vector-borne disease control program to overcome. And I'm gonna, in the next slides, sorry, I'm gonna be talking about the relocation of the capital city of Indonesia, which is from malaria-free areas in Jakarta to Ibu Kota Nusantara, which is one of the remaining hotspot of malaria in East Kalimantan province. So this project is one of most ambitious infrastructure projects in Southeast Asia. And on the next slides, I'm going to be showing you the slides of how the current progress of the new Ibu Kota Nusantara, or we call it IKN development. As you can see here, that before the development started in April 2022, you can see the picture on the left side, and then you can see how the massive changes happen in very short times, which is in 2 years' time, in February 2024. So despite goals of creating a sustainable capital city, this large-scale disruption and clearing of forests associated with the development of planned urban centers, and also, like you see here, the expansion of roads and associated industries has the potential for extensive environmental degradation, both within the new IKN areas and its surroundings areas. And then on the next slides, I would explain to you what does it mean then for malaria transmission. So basically, if you see this epidemiological threat for malaria, this massive development could actually impact the disease epidemiological threat, leading to things like emerging of the zoonotic malaria, something that happened in, for example, in other Southeast Asia setting in Malaysia. It could also lead to emerging of other vector-borne diseases. And you can also see in my slide here, like the development of activities could also lead to increase in number of susceptible population, because there are thousands or 100,000 of people that will be moving from the current capital, the previous capital cities in Jakarta, which is malaria-free, and then they will be moving to the new Ibu Kota Nusantara, which is one of the malaria hotspots in Indonesia. Not only that, of course, many susceptible population will also come from people, outside Jakarta, like, for example, in Java, that will probably frequently travel to the new Ibu Kota Nusantara for, administrative purposes. This also means that the new capital city could also means that in the future time, we will be seeing increase in number of imported cases, because people traveling from endemic areas in Indonesia, for example, like in eastern part of Indonesia, like East Nusa Tenggara, West Nusa Tenggara, and also like in Papua, they can travel to the new capital city and then bring infection. This also lead to an increase on numbers of mobile and migrant populations, such as workers flying from outside East Kalimantan coming to the new capital cities. And what about the environmental aspect of this current situation? Of course, we may I think we can see in the future that like the massive land use changes, clearance may just open new opportunities for vector-borne diseases. In this case, like malaria, because then it will serve, or it will provide more favorable vector habitats, for example, and then there will be also increase in number of forest-related occupation, like what we actually have been observing lately. And finally, these massive environmental changes will also lead to potential human and wildlife conflicts, like what happened in other sites of Indonesia, for example, in North Kalimantan or North Sumatra, where we also have done our previous studies. We observed there's an increase in numbers of human and wildlife interaction, which also can lead to emerging risks of the zoonotic malaria transmission. On the next slides, I think you have seen these slides from Swapnil, which is a map published in 2016 by Kim for National College, which actually illustrates how the extensive deforestation was strongly associated with the emerging Plasmodium knowledge infection in Sabah, Malaysia. And we know that many studies have suggested that across Southeast Asia, malaria transmission primarily occurs in forested regions and is mainly associated with occupational activities such as loggers, miners, logging and mining and those kind of things. And on the next slides, I'm going to be talking about then the current situations of malaria in IKN. So as you can see here on the left side, on the line graphs, you can see that before the IKN development, which is, I think the cutoff it was 2021, you can see that there has been a significant significant success in decreasing malaria incidence in East Kalimantan province. But at the same time, if we zoom in into one particular area on the right side, which is the figure B, so the red areas is basically the one specific district, which is Penajam Pasir Utara district, where the IKN area is currently developing. So you can see that despite of the significant improvement, we can see that the malaria transmissions remains spatially highly heterogeneous, where most of the areas of the IKN are at higher risk of malaria. Next slide. Now zooming into what happening after after the development of IKN started, and zooming into particular areas in Penajam Pasir Utara district where the IKN is located. As you can see here from the graphs, we plotted the number of malaria cases reported to the surveillance system from 2020 to up to May 2024. Based on this data, we can still see that, even in the one particular district, the malaria transmission remain highly spatially heterogeneous. And based on our colleagues' field investigation, our colleagues from the local health offices at East Kalimantan and Penajam Pasir Utara district, we found that the recent malaria transmission were associated with overnight forest-related activities such as logging and activities like watershed rehabilitation. We also found that the current rates are related to imported infection among migrant workers coming from malaria endemic settings outside of the East Kalimantan. And one interesting finding is that in May 2024, we found one human PCR confirmed P-nodocyte case was detected not in IKN areas, but in the IKN surrounding areas. If you see on the health facility on the left side, actually the P-nodocyte case was found in one particular catchment areas of the health facility with the highest reported cases of malaria, which is Puskesmas Sotek, the one in the middle. Yes, yeah, thank you. And next, to respond to this current situation, the current control programs, both from national malaria control programs to province and also local authorities in IKN, have responded by prioritizing some control and also surveillance activities. So on 31st of May 2024, the local IKN authority has just established what we call as Bebas Malaria Task Force. If you translate it directly, Bebas Malaria means malaria free. So here I call it Malaria Free Task Force. So the specific task force that is assigned to, basically improve control programs in IKN and surrounding areas. And as you can see on these tables, there are several activities or several strategies that are currently being done by the local control programs in IKN and surrounding areas. If you can see on the left side, for IKN itself, there is a screening for new construction workers developing IKN. So every newcomers, new kids on the block, like like Swapnil said, will be screened. And then the control program will also do factor control measures such as long-lasting insecticidal nets and also IRS activities or distribution in laborers' dormitories. So this is basically for IKN. They are not doing this for the surrounding areas because the focus at the moment is within the IKN development areas. And also in IKN, the control program is doing routine larval monitoring and management across the IKN areas. And if you can see on the right side of my screen, for the surrounding areas, the routine programs cover screening among migrant workers entering and leaving. So outside the IKN areas, in the surrounding areas, there is programs have been running now. There is basically doing screening among migrant workers entering and leaving. So by doing so, we are hoping that we can capture any potential infection. And then the control programs are also doing bi-weekly mass fever screening in the IKN surrounding areas. And same like what they are doing in IKN, but in more wider kind of context, the control program is also distributing the LLIN for high-risk population. For example, in here for pregnant women, for mobile and migrant populations such as migrant workers, forest loggers, farmer, rubber tappers, and other population working and spending nights in the forest. While for surveillance and responses, in both IKN and surrounding areas, the current control programs will strengthen the surveillance and response strategy by ensuring, each new case is investigated promptly and in a timely manner. And then the authority is also now reactivating what we call as forest malaria station, basically a station or a satellite sites that is responsible for malaria testing and treatment for people working in the forest. Now, I think I realized I still got time. Yes, next slide. I would like to know before, thank you. Like I said before, this is a work of ongoing work by many people. In here, we are a group of researcher, academics, and also we are collaborating with malaria control program at national level and district level. And we also are in collaboration with experts, malaria and vector-borne disease experts from the WHO Indonesia and environmental health specialists from the UNICEF Indonesia as well. And to conclude this presentation, I would like to say that now we are currently doing research activities trying to evaluate the association between historical changes in climate and environmental with the incidence of malaria and dengue, utilizing the historical data of dengue and malaria cases in IKN. And beyond that, we as a group are looking forward for any future collaboration and support that are seeking to assess the current dynamics and potential risk of malaria, particularly pre-nootropic, and research around how to best mitigate the risk in the context of massive landscape changes, factor and wildlife distribution, and also human determinants like mobility, immunity, and healthcare access. So those kind of those line of research will be our priority in the future. So we are welcoming colleagues from the globe to join us, support us, and collaborate with us in addressing and mitigating emerging risks of malaria and other vector-borne diseases in the new capital city of Indonesia. That's all from me. Thank you. I will give it back to Kim. Thank you.
Excellent. Thank you so much, Henry. I think that was a really fantastic example of some very practical steps that a malaria control program can actually take to address some of the changes that are happening. So with that, we will open up the Q&A session. So we will have question and answers for the next 30 minutes and try and get to as many as we can. So please do add your question into the Q&A box and feel free to upvote other people's questions as well if there's anything you would really like us to answer. Great, so we have all the panelists here. So I will start with the first question from Bilal from Afghanistan. And this question is, due to climate change, do you think malaria will reemerge widely in areas where malaria is already eliminated? If yes, what would be your recommendations for the governments? So maybe Isabel, you could take this one.
Yeah, I can attempt it, definitely. I think it is probably quite likely that we will see malaria reemerge in places where, well, emerge in places where it maybe was never transmitted before, but also reemerge in places which have successfully eliminated it. I think one thing which would be really important is to have your healthcare practitioners not forget to include malaria diagnosis or malaria testing in their kind of suite of tests, and to kind of be continuing to train up the new healthcare in malaria symptoms, even if it hasn't been seen in your country or your area in a long time. So that will kind of allow for increased surveillance within populations which are coming to health facilities. As well as that, keeping up kind of entomological surveillance as well for malaria vectors, and looking as well at resistance within your vectors or your parasites to treatments or to insecticides, maybe in bordering countries, and so to be aware of what may work if you do begin to see cases cropping up. Yeah, also looking at, I would say, imported cases, and also from kind of similar to what Henry was presenting today, looking at high-risk populations. So if you know that it may be coming, if you know that maybe forest workers or construction workers or certain maybe migrant populations may be at risk, at higher risk of kind of contracting malaria, then keeping surveillance high in those communities would be really important as well.
Fantastic. Swapna?
Yeah, I just wanted to say that it has already happened, right? So Italy actually in last 3 years have been reporting non-travel related malaria cases, although they are still quite low, but it's like 5-6 cases have been reported. This year there were 3 cases or 2 cases reported in 2020. So we are already seeing those effects coming down, trickling down.
Yeah, I think that's a really, really important point. Swapnil, I have a question for you next. So politicians tend to be skeptical about the outcomes of scientific results and are even more skeptical about modeling. So how would you work towards overcoming this gap and have modeling outcomes translated into policies? An easy one.
Okay, that's a tough question, but actually, equally, the other thing is that if you talk very clearly and you make modeling look like something that they can understand, because surely if you go and talk about models in terms of their mathematics or in terms of their statistics, that's something that they're not able to. But if you can translate your models into language that they are more able to adapt, they're actually willing to listen. And skepticism essentially comes to everybody because they cannot understand what's happening. So which means onus lies on us to translate into the languages or translate into a piece which it's where they can adapt to it more. And okay, I do also say about same politician, but I feel it's also the other way. Actually, modeling has helped to transform a lot of public health policies, and that has happened. So people are happy to listen if you talk in the languages that they care about. So I think it's just a matter of being open and being transparent. If you are happy if you can do those two things, which means you can talk to people, but even if they don't agree, but you give them an option to question you, if they give them an option to test your stuff, people end up coming down to that. So I think those are the ways to go around it mainly.
Excellent. Thoughts from anyone else? Or Okay, we have plenty of questions. So one from Effie from the Philippines. Maybe Henry, you can take this one. Addressing the effects of climate change is country specific, as it is very dependent on the resources, especially in collecting the right data and having the skills for data management and analysis. In addition to grappling with adequate management and response to disease surveillance data of the varied vector-borne disease programs and NTDs, what could be some of the first steps and guiding principles for countries? And maybe the kind of approach that we've seen in Indonesia is a good example of how to go forward.
Yeah, thank you. Thank you, Kim. Yeah. I think, agree with you, Kim. Thank you, Effie. Yes, what we are trying to do at the moment is that we're currently doing kind of pilot study. Kim can also expand on this, where we try to collaborate like strongly from national level to local level. Stakeholder. We involve everyone, including like academics from the local universities, like for example here in East Kalimantan. And what we are trying to do in terms of building local capacity, of course, connect because we cannot do it by ourselves. I'm no expert in modeling. We know Swapnil here, so I contacted Swapnil. I know Kim is expert on spatial epidemiology. I saw some people here. My teachers, Professor Chris Drapley is here, expert on, expert on serology. Of course, we link with other people. So that's what we are trying to do at the moment. And also, more importantly, is start early to, as early as possible to talk to other people outside the health sector as well. We are trying to build that connection with other ministry as well in Indonesia. But yes, then that's where the money become an issue, because we need bigger infrastructure, bigger resources. Then we need to work out on that. But I think that's all from me for now. Kim, thank you.
Excellent. No, thanks, Henry. And just for kind of following up on some of the points you raised there. So there is a comment that one thing that is confirmed is that there's a direct link between climate change and its impact on malaria transmission. But does the malaria research community engage with the mitigation and adaptation community in other sectors, for example, agriculture, energy, infrastructure, to check how their sector-specific measures may impact malaria and other NTDs? So for anyone, any thoughts about this? I know it's something we've been very interested in because I think there are still some silos that exist.
Yeah, I think you're right that the silos definitely do still exist. And I think there are efforts ongoing to try and break these down a little bit and to try to communicate between these sectors. Especially I just have more knowledge around the kind of agriculture and malaria or general vector-borne disease side of things. As well as kind of looking at the negative impacts of between them. There's also a real opportunity that's, I think, quite untapped, looking at kind of co-benefits that can be found. New kind of adaptation or mitigation strategies, which at once kind of reduce the effects of climate change, but also may reduce the health impacts of certain agricultural kind of tools or methods as well. So I think that there's, as well as kind of sharing the responsibility between the sectors, there's also real potential for being able to work together to try and bring down the negative effects of both climate and on the climate and on the health as well.
Excellent. Thoughts from anyone else? I think Henry gave a really nice example of infrastructure and how that's been considered.
I mean, I just wanted to also highlight, acknowledge that the work that are still being conducted now in North Kalimantan and in North Sumatra in Indonesia, led by Matt Grigg from the Menzies School of Health Research in Darwin. It's a complex study aiming at evaluating agricultural land use changes, those kind of things, with the risk of P. knowlesi and other malarias in those settings. And then I believe as part of that, we have a specific group who are trying to also answer that question in terms of, like the local agricultural practices, and then how they will use that information to inform the agricultural sectors at the province and national level. But yeah, it's ongoing work, and I'm also looking forward for the result and impact. Thank you.
Yeah, excellent. So I have a question for everyone. So climate change majorly affects vectors and vector behavior. Will it be possible to look at the issues separately rather than combined? For example, increasing temperatures will have separate impacts versus high rainfall and extended rainy seasons will have a different impacts, which might also vary in different geographies. Indirectly, there may be impacts due to the migration of people away from flood areas, which have become inhabitable. So is it possible to actually tease apart some of the different mechanisms that are actually impacting malaria?
I can start with so that people get a bit more time to think. So yes, so I think it's a very good question, and that's actually a scientific question that people want to answer, right? And there is a lot of work that's happening around where people can look at those things, but essentially the problem that lies here is this, right? To tease that out, you need to understand vector and you need to understand the vector population. Right now, we are in a state where now we are finding it difficult to even sort of get the real estimation of the human population. Then it becomes a bit more when you want to estimate the vector population. So yes, if you are in places where vector populations can be measured, where things are there in quite a lot. So like Singapore is one of the examples where you see a lot of work around vector population, where the vectors are, and then what's the effect of stress from the vector. And that's actually one of the reasons why Singapore was at the forefront of looking at doing Wolbachia for dengue, because they basically had better understanding of their vector population. So it's happening, people do that, but it comes with its caveat or the problem of basically just knowing the vectors and knowing the vector population. So it's still a work in progress, and yes, it's something that we all strive to do, but we are a bit far from there to really get those things.
Kimberly, if I may jump in for a moment as well.
Please do.
Thank you. So, Swapnil, you point at something that is of great concern to the medical entomology community globally, that, since about the 1990s, when there was a shift to heavy reliance on impregnated bed nets, insecticide-treated bed nets, just simply distribute, and that's become our primary tool for vector control, supplemented to some extent by indoor residual spraying. But by and large, the malaria endemic world relies on insecticide-treated bed nets as our primary strategy for malaria control. That's our single most important strategy to control malaria. So it's become a practice of just distributing bed nets. So this whole issue of the impacts of expanding impacts of climate change, extending the geographic range, and so on, it becomes complicated because, yes, the temperature and rainfall factors may suggest that the range is increasing, but as you point out, Swapnil, it very much depends on which species of mosquitoes are involved and how they respond to the particular temperature and rainfall and other factors that are a consequence of global warming. So you correctly point out we need to understand the particular likely responses of particular vectors that are prevalent in those specific geographic areas. And you need qualified medical entomologists to do that. Not entirely only medical entomologists, but to a large extent, people that are very familiar with mosquito biology and taxonomy or so on. And those are critically endangered resource globally, where we've become a community of bednet distributors, and we don't have enough qualified entomologists that understand the underlying biology of these. So, you know, another aspect that's been neglected that nobody really talks about, but we better start giving more attention to it, is because of these increasing threats, such as with climate change, we need to increase our pool of medical entomologists. I could go on for a long time about this, but I think let me keep quiet from here on.
No, thanks, Leo. I think that's a really important point. And something that I think that's also very true is that the models are only as good as the data that you can put into it. So we do really need a lot of data and field-based data. So along that question, I have one more kind of question for Swapnil, but just are there any indices devised to directly monitor the proliferation of malaria in an area, or how do we have the ability to combine various indices together? How reliable is geospatial data in order to monitor vector-borne diseases? And is it convenient and accurate enough for this purpose? And I think this links in quite nicely with the point that Leo just brought up.
Yeah, so that's a long question with a lot of research around it. So, okay, there are, I would say there is no one indices that people prefer, like people have their different versions of indices that people talk about. There is no consensus about, more or less people end up talking about what is the prevalence per 1,000, per 100,000 people, and things like that. At times, there is a bit of things about like how is prevalence different by different kinds of malaria, but not more than that. So there's nothing out there as such. But yes, you can combine a lot of other things to come up with an incidence, like, and basically you try to come up with something essentially to somehow map incidence and prevalence and talk about that. And it is still something that gets widely discussed. Now, how good the models are. I would not say they are perfect, but we have been improving, and we have been. I think if you look at the estimates, and if you look at how good those estimates have become over the last few years, you would certainly see that we are getting more towards reality. But then, as Isabel pointed out, as Henry has pointed out, and as we have been talking, the reality unfortunately is also changing. Right, so the reality is changing every day, but I think we are still in a good world where we are getting there. People are understanding more, and people are trying to account for at least a lot of those things, and which means that you're still not there, but actually at least you are at a stage now where I feel that your geospatial signals that you can get from a lot of climate or satellite image data is becoming almost as good as hand-coded survey data, or if not at least as good as, like, you supplement a bit of survey data with a lot of satellite data, that's as good as a lot of survey data, right? Which basically reduces the cost, it reduces this thing. So we are getting there is how I would say that.
Leo, please go ahead.
Yeah, and I'll try my level best to be quick and short on this one. Let me see if I can succeed. So, yes, I agree, Swapnil, you know, and with everyone, that modeling is critical and important and essential. But, you know, modeling only takes you so far. I want to use the example of Pakistan in 2022, where, you know, I don't think any existing model could have predicted that there would have been this unexpected episodic event that pushed malaria from prevalence of 300,000 cases in 2021 to more than 3 million in the year of the flood events and so on. So it just points to the fact, and also during that same outbreak, the habitat changes and the vector responses were such that it caused a shift in the particular species that traditionally were responsible for malaria transmission to a completely different species that previously did not have an important role. So these things are difficult to predict. You know, how do you predict I suppose there are ways, and you're the experts in that, of unexpected major events, such as those floods, that have very dramatic consequences, not just in creating massive breeding sites, but also displaces people and forces them to live in conditions where it's very difficult to hang bed nets from emergency shelters and so on. So my point is, one has to think a little beyond just modeling approaches in trying to prepare and be ready for these climate change situations.
Excellent. Thanks, Leo. I think it's a really important point. I think that to recognize that the models have their limits, but also there's a real question about how we use some of the model predictions. So if we have an event that's unprecedented, that has never happened before, the chances of us predicting it well are very low. So we really need to kind of, I think, get away from trying to have predictions of the future with there's exactly this many of malaria cases that will happen at this time, but think, what are the kind of high-risk areas? What are the high-risk times? How can we mitigate it? How can we make decisions under uncertainty? And I think one of the real questions for modelers, and others here might agree with me, is thinking about actually, you know, how do we communicate uncertainty? Because it's not something that people tend to like. Just to kind of wrap up, as we're near the end of the time, maybe Swapnil, since you need to run, maybe all the panelists could just kind of wrap up with some closing thoughts, but I'll let you go first, Swapnil.
Thanks, Kim. So first of all, thanks, Leo, and reminding, and I totally agree. And as Kim said, models has their problems and they won't be always correct. In fact, they might be correct. And I think that's the thing that we all have to agree with. But I think the point that I will try to say in general is, there are places where models might be correct, and those places are which I think are the things that we can at least sort of prevent now, because that has some patterns or things which we can prevent. So let's better act on things where we have some power. All other things essentially requires a lot more work and we won't be able to do. So I hope that after this, people would think more about creatively how different kinds of data could be used, and how where we can find patterns at least which repeat and which are preventable. And that's the whole hope behind it.
Excellent. And Isabel, any kind of final thoughts from you?
Yeah, first of all, thank you to everyone involved and for organizing it and having me on the panel. It's been really enjoyable. I agree with everything that's been said. I don't want to knock modeling in any way, but I think it's one tool along, you know, that is, you know, there's a lot of other tools that we have that we can use as well. And really the main finding, or the main kind of recommendation that came from the review, which I discussed, was pushing for a more kind of standardized and collaborative way of modeling and using these models, so that we can kind of work together to be able to get more certainty from them and use them alongside our other tools. And then in terms of extreme weather events, learning from what has gone wrong and what has gone right in the past, it's very hard to predict these. So what we can do now is learn from what has happened, I think. Yeah, thank you.
Excellent. Thanks, Isabel. And Henry, any final thoughts from you?
Yeah, thank you, Kim. I think from me is that it's clear. We all know that changes in climate and environmental will impact vector-borne diseases, especially malaria. And we know that there's technology out there, a lot of people, a lot of experts. So I think I'm just inviting people to, you know, let's connect and work together and, yeah, solve this problem together. Thank you.
A very positive message. Leo, anything you kind of wanted to add at the end?
Maybe just to say that I think modeling is very useful in warning or indicating which countries or geographic regions are at risk of being invaded due to favorable conditions arising in those areas due to global warming, climate change, and whatever aspect. To to enable the appropriate people in those potentially invaded new areas to initiate surveillance so that they're aware of this developing risk and that they implement appropriate surveillance and monitoring practices and so on. And then critically important also for countries to make sure that they have the essential strategic guidance, policy documents or strategic plans that they develop and have those in place in the event that, you know, that country is invaded or that geographic region is affected in a way that will promote disease transmission by these vector-borne diseases and so on. So you're not caught with your pants down and you don't have the necessary plans in place. What do I do now? You know, we've had a major flood event. What do I do? Plan and be prepared in advance. It's the suggestion. Yeah.
Yeah, no, I couldn't agree more. And I guess just on that note, I think one of the things we're really trying to do with this special interest group is draw some of these people together to look at examples of how different groups have responded, what works and what doesn't work. So we really do want to kind of build up a wider community of practice. And so please, for everyone who's joined, don't hesitate to get in touch. We would like to hear from you, and I think we'll be looking for kind of more examples of case studies or lessons learned and different approaches. And so I believe the webinar will be available on the YouTube channel, or feel free to email any of us. And thank you again for everyone for your time.
Thank you, everyone.
Yeah, I think from everyone, audience members, all of us, a great big thank you to our presenters and Kimberly for running such a very efficient and highly instructive learning opportunity. From all of us, a great big thank you for doing such a great job. Fascinating, very appropriate, very relevant, and well done. Thank you so much.
Thank you all.